Hi, let's talk about dentures. I see a lot of denture talk on TikTok lately, and I decided to come on here and make a TikTok, and probably will make a few about dentures and what patients need to expect when they're getting new dentures or if they're getting dentures for the first time. I'm a denturist and I practice in Southern Oregon. I've had my own practice here for 12 years and about 20 total years of denture experience. The types of things that I see on TikTok are usually patients who are giving testimonials about their own experience with having their teeth pulled and having dentures placed, or fitting dentures that they're having done subsequently to their first pair of dentures. Some of this information is really honestly made to be helpful for other patients that are going through this process, but a lot of it I do not subscribe to, and a lot of it can be very harmful to your gums, to your facial structure, to your temporomandibular joint, which is the joint up here in your jaw. So I want to come in here and start a little series of educational TikToks. So let's talk about one of the things that I've been seeing quite a bit. Patients refitting their own dentures with adhesives or cushion grip type things, or sometimes even laboratory putty that they have picked up on Amazon. So when you're making dentures, one of the most important things is establishing your bite, which is called your vertical dimension of occlusion. That is where you put your teeth together, like that. You also have the vertical dimension of rest, which is like this, when your mouth is just barely open and you're at rest. Those are two very important measurements when it comes to making dentures. We establish this when we see the patient and we do measuring, we make marks on their face, we measure these things, and there are strict parameters to stay in for these measurements when you're making dentures. That's very important. Another very important thing is taking the impression. You have to take the impression and make the denture with that impression so that it fits to your gums perfectly, to your harder palate where your gums are, to your softer tissues under your tongue, on the sides of your cheeks, up here at the top of under your cheekbone. All of those things are very important when it comes to the fitting of dentures, chewing, speaking, and comfort in general. So when I see patients putting materials in their dentures, such as cushion grip or lab putty or goop, adhesive, glue, whatever you want to call it, it can be really tricky. First of all, please don't use things that are not designed to be kept in the mouth, like lab putty. Laboratory putty is something that we use in the laboratory setting while we're making dentures. It is not something that is supposed to be held in the mouth, kept in the mouth, and worn in the mouth. There are chemicals that will leach out of those products into your mouth, and there's so many health concerns I can't even touch upon those in one video. Second of all,